I want to start first by like just giving a little story behind like how I met Sean, because I think it's one of the greatest stories ever. So I'm in the elevator of Quantum on the Bay. I lived in the penthouse of Quantum across from Mario Chalmers, and I was in the elevator with my two dogs, and I think I even might have had my puppies then. I can't remember, but like I know I was in the elevator with some dogs, and I was obviously in pain. I don't even know how Sean realized I was in pain, but he said, "Are you in pain?" And I was like, "Yes." And I said, I've been in pain for like the last 3.5, 4 years, 24-hour pain, and suffered from a fracture in my back. And so he literally was just like with just glowing confidence was like, "I can fix that." And I've never heard anybody say that before. And so I was like, "How?" And he's like, "Well, it's a thing called prolotherapy, blah, blah, blah. And you let me inject you, I can do it in your house like that." And so make a long story short, he shows up at my apartment. He injects me like 50 something times in my back with this gigantic needle. Like I'm cussing him out the whole time. And he used, what was it, Sean? He used volcanic ash.
Back in the day, yeah. The first few years I did use that. It was pumice and quinine, and pumice is volcanic ash, dextrose, and sodium morowate.
Yeah.
So a lot of those things, we can't really get right. Some of them aren't even made anymore. So,
but it was wild because he told me that I would be worse before I got better. But again, when people say that, because you're in so much pain, you don't think that it could be worse. And sure enough, I woke up and I was in the worst pain of my life. Like could not even tie my shoe. And at the time I was taking care of my girlfriend at the time, her 2-year-old daughter, by myself all day long. So I was like, this is how I called Sean up, cussed him out. Like, "What have you done to me?" And he's like, he was, and I knew right then and there that we would have a good relationship because he was very patient with me. And that's when, I was a little crazier than I am today. And he was very patient. He just said, "Hey, just give it 48 hours, give it some time, let it kick in." And then sure enough, 3 days later, I was in zero pain and felt like my 25-year-old self. The rest is history. He's been shooting me up ever since. But let's go around and just tell a little bit about who you are,
all right,
what you do, all three of you, just so we can kind of lay a groundwork of your specialty and like, a foundation of who you guys are so the audience knows.
All right. So I'm Kristopher Goddard. Everybody calls me by my middle name though, Sean. And I'm the founder of the Osteopathic Center. And I got into this because I got injured myself over 20 years ago now. Amazing. And I was being filled up with pills and offered surgeries. And the only people to fix me were somebody who did these injections, and along with the craniosacral therapy and along with acupuncture. So that's what really made the difference. And just made me have a quest for lifelong learning. And I met you at the beginning of my career, and so now it's evolved. And I, lucky enough to have 2 experienced docs with me now. This Miami location, and we have another one in a Jupiter location.
And you're also in Knoxville.
Yeah.
Well.
So sorry. Yeah, we have three total locations right now: Knoxville, Tennessee, Jupiter, Florida, and Miami, Florida. Jim, of course.
Yep. IV suite.
Yeah.
Doc?
I'm Jesse Morse. I am a family and sports med doc. I did a fellowship at USF in Tampa, and then I did a couple of years of traditional sports medicine at an ortho clinic. And then I came over to the Osteopathic Center, where I kind of wanted to escape traditional medicine. I didn't want to see patients for 7 minutes at a time, and sick of being told what I could and couldn't do by insurance. And I realized that wasn't really medicine anymore. And I was sick of spending 8 hours with patients and 3 hours writing notes after. So I said, I'm taking my life back before it really starts medicine-wise, and decided to join a practice that was predominantly out of network and have the luxury of being able to see patients the amount of time and commitment that needed to actually treat said patients.
Michael Meighen, I am board certified in physiatry or non-operative orthopedics and pain. That's kind of where I started my career. And as I was going along and injecting everything, primarily with steroid, I was seeing that few people were improving, getting better, recovering, getting back to what I felt was their life. And introduced to prolotherapy initially, probably about 16 or 17 years ago, which dovetailed into other forms of regenerative medicine like PRP, or platelet-rich plasma, stem cell products, fat, bone marrow, name it. And then the other part that I really got into is more the precision medicine health optimization, where I kind of take you where you're starting and try to, with your goals, and then data, blood work, genetics, wearables, you name it, kind of take you to where you want to go. And that could be anything from, I have some clients that are triathletes that are really trying to impress or improve their times, to grandparents that just want to play with their grandkids readily and have a good, more quality life, improve their longevity and that sort of thing too. So joined the Osteopathic Center about a year ago. We have a great synergy and we have great crossover of things we do, but we also have our niches as well.
I'll say the thing that I have noticed just from being with Sean is that the customer service and the attention to detail has improved since you brought on guys. They actually care, they follow up. Not that you weren't doing that by yourself, but you're having help now.
Yeah.
And I think that's important, and also just bringing in people that kind of back you up on your beliefs, because a lot of times, sometimes you get the opposite. Someone like actually saying, "Oh no, don't do that," and now you've got guys that are kind of pulling this alternative, medicine, which I think it should be at the forefront. I guess let's dive into a little bit of some of the biggest success stories you've got, and you don't have to name names or anything, but just some of the things you've seen through these injections that just kind of like wow you. I know y'all have a lot. I mean, I know I'm a case. I was told I would not be able to do a lot, and I'm pretty much doing everything that I want to do at a high level. We still got some work to do on my hip, but we'll get there. But I know y'all have worked on several athletes and got them back on the field, back on the court, or what have you. And let's just touch on some of those. And again, just any examples you can give, just for people out there listening that might think that surgery is the only option. And, maybe we can shed a little light on there are alternative ways to get healed.
One of the surgeons wanted to take one of your vertebrae out.
Yeah, literally.
It was extreme. Like, I've never even heard of that before. But your case was one of those, early on, and they got you back to doing everything.
Yeah, to touch on that, so I was 1 week away from going into surgery where they were going to remove my disc and put 6 screws and replace it and then fuse everything. And I was 1 week away from that. And I called the place immediately and I canceled it and said, I'm not going. And then I went and put it up to my apartment to get injected. So
yeah, it was a process, it's not like we do one treatment and that's it, and that's the biggest thing. I think the hardest thing for us to get across sometimes we get those great cases, right? We do it one time and people just get better. But realistically, doing multiple treatments is the best thing to do for long-term results. And that's the hardest thing for us to get across. For us, it's just trying to really decide and understand what the goal is from each patient. If we're having a professional athlete come in, it's a lot different than somebody who's just needs their pain to go away to work, right? Because we've got to be able to get the athletes back to the field and play at a high level. And typically, we don't have a lot of time. They come with us, hey, I need to be playing next week or within a month. And, and that just makes us decide what we're going to inject. We have products we get from you, like everybody's heard of PRP. Well, not everybody, but it's out of your blood and platelet-rich plasma or bone marrow. Those are those are the most common things done, but they create lots of inflammation. So your healing time is going to be a lot longer. Whereas if we use a tissue allograft, where it's very anti-inflammatory, then we're going to get quicker results. So, I think probably the most extreme case for an athlete I've treated was a completely torn PCL, as well as a partially torn ACL and some meniscus stuff happening. and he decided he didn't want surgery. And so the first treatment was with tissue allograft, and he was having pain just walking on his knee. So we did the tissue allograft, and then followed up a month later, did the bone marrow. And about 6 months later, he was full activity, played the entire next year. Didn't have surgery for
The football player?
yeah, NFL, defensive lineman.
Yeah.
And playing every snap too.
That's amazing.
Yeah. So that's one of my greatest stories from that. But even let's take it a little minor, right? Like you had sent me an athlete that had a ankle sprain, and literally injected him, and 3 days later he's playing again. So that's how powerful these treatments can be and get people back on the field. Now, just from what I've seen from anybody, people always ask me, is there an age where we just can't inject anymore? 3 months ago, I injected a 92-year-old gentleman, and he just wanted to be able to walk. He wanted to be able to get up and get in and eat and do stuff every day.
Yeah.
A month after we did a tissue allograft treatment on him, and a month later he was doing everything.
And when you say tissue allograft, that's kind of like stem cells, right?
So
I know you're not allowed to say
technically
say stem cells, but
Yeah.
I mean, just for the novice out there, I mean, that's
Yep.
the most relatable word.
Yeah, thanks for bringing that up. Yes,
Yeah.
stem cells has gotten it's put us down a road where the FDA doesn't like it, but all the research was originally done on that terminology. So now there's such a big controversy. Should we be using that term? Should we not?
Right.
And technically, it is referring to the actual cell, and a mesenchymal stem cell, and a lot of us now believe it's a medicinal signaling cell. So it's a little different than what we used to think it was. But that cell is in your body. Bone marrow has a very small percentage. Adipose has a high percentage, and other products in the U.S. have kind of gotten out of fashion at this point. We talk about tissue grafts. We talk about growth factors. That's kind of the terminology where all this has moved to. But if you hear a stem cell treatment, usually it encompasses everything.
Okay.
We just met with a company last week, and actually haven't even told you yet. Maybe they did. I don't know. But where we can take your adipose and send it to the company, and they can culture expand it. Because in the past, we've always thought you have to go overseas for that. Right. Well, now we have a resource in the U.S. that can do it, and they can bank it and store it, and then we can get it back. And whether we can do the IV or we can do an injection.
Oh wow.
So yeah,
that's big news.
Yeah.
And I mean, correct me if I'm wrong, it actually helps cost too, right?
100%.
Yeah.
Yep. Much more cost effective.
These guys are really expensive, so but in a good way. You get what you pay for. So. Let's talk a little bit about, because you're coming from that, like you said earlier, you're coming from that traditional orthopedic surgeon. The first thing they want to do is like cut on you, like what have you seen being a part of this group, the biggest difference in being able to help people?
So one of the things I always, my goal for a patient visit, which are an hour long, not your 10 or 15 minute traditional appointment, my goal is to always give them more information than they came in with, and give them an idea of what their injury is, what's going on with it, and what the surgical and non-surgical options are. Whether or not they decide to do what we have to offer is up to them. But the problem with most patients is that they're not getting all the information beforehand. So I've had patients reach out to me all the time, like, oh, I didn't know that was available. I wouldn't have did my surgery or XYZ if I didn't, and if it was available.
Because most traditional are only giving them one option.
Correct. Right? Most of the traditional ortho surgeons or primary care sports medicine, which is what I am, aren't doing a lot of the stuff that we do. So they don't offer it because it's like, well, I can't offer. Most of the time they're thinking, if I don't offer it, I'm not gonna say it to them, because then I'm probably gonna lose a patient, and I don't know enough about it to be comfortable talking about it. Right. It's slowly progressing, but it's not as many. Most surgeons believe that most of the stuff has to be cut in order to fix it. And we've kind of shown that it really doesn't have to. You just have to use the correct injection approach. So a lot of the times I'm spending time educating, kind of giving an idea of what's going on, why it's happening, how to correct it, the importance of physical therapy, the importance of correcting a lot of the mechanics, and indirectly injecting different structures, whether it's the ligament, tendon, the joint. You kind of have to hit everything comprehensively, because if not, you're just, just hoping that it fixes. And the issue that I have with traditional medicine is they're pretty much dominant on corticosteroids or cortisone shot.
Right.
And the problem is, it's like they put it in there and just hope that everything magically goes away, but it doesn't change the tissue. All it does is basically trick the brain to thinking, hey, your pain's gone, but it doesn't really change anything. So 3-4 months down the road, if you're lucky, the pain comes back because the cortisone wears off, and guess what comes back?
Right.
You know,
it's like a Band-Aid. I mean, almost everybody I
Yep.
talk to that gets cortisone shots, they feel great for 3 months and then
Yep.
they're back at this.
And the problem is that you're turning a mild injury probably moderate because you're still pushing through it.
Right.
Pain is that reminder to say, hey, you shouldn't be doing this. There's an injury here. But the cortisone makes the pain go away. So, but it doesn't fix the problem. It just makes the pain go away until it comes back worse. And then you have less options because the injury is more severe. So we traditionally don't do any steroids at the office. Every once in a blue moon, maybe a little bit in the spine, but that's about it. We're trying to use options that are going to heal the tissue, make the tissue stronger, and make it as close to 100% functionality as you can. When I look at an image, I want to correlate that with exam. I want to correlate that with the person telling me what they feel. I treat people, not pictures. The pictures help to describe what's going on, but it doesn't always tell you the whole story. So you kind of have to put everything together. Sometimes we're doing, we call a diagnostic lidocaine block, where we inject to see, is that the actual injury? Or is that just something that isn't really creating pain?
Sean loves to do that.
Yeah. It makes
more
much
needles,
sense.
the better.
Yes. But that was very well said. Especially the thing that stood out to me was I don't treat pictures, I treat people. That's huge, because I feel through my process, just going to these doctors and they whip up they put your pictures up there and they just start pointing and saying, what has to be done, instead of asking me how I feel. And so that goes a long way. So keep that at the forefront, because people are who y'all are treating. So Michael, I had the pleasure of having you dive into my spine when we did the biodisc, and people keep asking me what that procedure was. And I would love for an expert to actually kind of give, people that, because my back, Sean, how long we've been at it for a long time.
Decade,
and I can sit here and say for the first time in like over 10 years, no back pain whatsoever, like none. And it's been
I'd kind of interject there. We got it. I'd say we got it 90% better.
Yeah.
But we always had that 10%. It made it livable, but we couldn't get you where you had no.
Right.
No
Well,
pain.
the thing that really stood out to me is like hanging on a pull-up bar. Like, it's a easy thing, or you would think, but like there's a lot of studies now showing that like dead hangs are really good for your longevity and good for your grip strength and things like that. And so every time I did a dead hang, just excruciating pain in my back. And I was like, this can't be normal. It can't be normal. And when you did the biodisc, that's the first time. And like to Sean's point, all his stuff, and again, y'all are a team. I'm not trying to say that.
That's what the great thing is. I didn't train in that, and having somebody on board that can actually do these extra.
And y'all injected me at the same time too, by the way. It was like a multiple situation. But I found that, again, it just goes back. It was the first time where it was literally no pain. Of course, then I started acting like I was 20 again and hurt my hip, but that's a whole nother story. This podcast won't always be about all my injuries and stuff. But anyway, so talk about the biodisc and what it is. And,
Sure.
Yeah.
So, in summary, we used a little bit of everything on Manning for his spine. So one of the products is actually an FDA-approved product called Biodisc, and it comes from desiccated nucleus pulposus, or inside part of the disc, of cadavers. So they take it out, they do all the cleaning and do all the things they need to do to kill all the bugs and all the other things, and then they have a process where they basically dehydrate it. It comes into a powder and is delivered to us in almost like a mixing bowl or kind of a drink. Almost. So what we do is we inject it with normal saline, and then we mix it up again, and we move it around and swish it, because it becomes very thick very quickly. As we've noted, sometimes it becomes stuck in the needle. Try to inject it back in. So we've got.
Why you're sweating so hard?
That's exactly right. Yeah, we had one last week that I had that the same way. But yeah, it sets up pretty quickly. And so you gotta move it very quickly too. So basically you inject it back in and then you pull the needle out of the disc. And then some of the others we did, I believe, bone marrow and some other things too. But the beauty of, we didn't just treat the disc, we kind of treated your whole spine complex. So hitting the disc, hitting the joints posteriorly. You've got a condition called a spondylolisthesis, where one vertebral body is forward on the other. And that probably happened as a result of some of your football activities and some of the other things too. So we hit that area into that defect, which I think also helped. And then we hit all the ligamentous structures. We hit all the muscular structures, hit the sacroiliac joint, supporting ligaments. So our thought process and the way we kind of define things is primarily due to instability. That's our thought, is the main focus of when things start. So, and Sean's exactly right. Trying to have people be proactive instead of reactive, I think, is very important. You have that first injury, that's the time to do it. Because, first sprained ankle, yeah, you're probably going to respond and get better and come back pretty quickly. But if you would hit it with something even as simple as prolotherapy, you can probably get that thing to heal, and down the road, you're not having arthritic change and some other things. It's a hard sell for some people. And it's
such a good point,
because our medical system is also reactive. Now, are we really good at being reactive? Yeah. You have trauma, hell yeah, this is the best place to be for those type issues. If it's more of a subacute chronic issue, we're not really good at those type things, which is where we are much better. So even acute stuff, I'm talking broken bones and fractures and things that need to be fixed.
Right.
I'm not talking about, you got a sprain of a knee ligament or something like that. But, I think the bigger key, and coming from where I came, where you're kind of told, okay, you can inject one or two structures and that's all you can do on this person, even though they have other things going on. There's no limitations. I can hit whatever I think is going to help you become your best self, give you the best stability, recovery, and those sort of things. And going back on one of the other topics is kind of hitting it again. Basically just telling your body, you still got a problem here. Let's kind of keep the healing process and that cascade going. And it stimulates your own stem cells from your own body to come into that area too. Some of your other growth factors and some of the other things. Yeah, your spine is a challenge. There's no two ways about it. But the beauty of it is we hit it really hard that time on top of what had already been done, which I think is very helpful. And kind of get that big part of the pain down. And then we just need to kind of keep hitting it here and there. Little touch-ups. The way we kind of define is if you have a bad car issue, say you got your engine problem, fix the engine, you're still going to have to rotate the tires and change the oil and change the spark plugs and change the filters and all the other things associated with that. So it's not just a one and done for most people, because you're still going to live, you're still going to lift, you're still going to work out, you're going to play whatever you want to play with your kids. All the other things associated with that. So to us, this is kind of an ongoing treatment as opposed to kind of a one and done thing. So we try to have situations where we're just constantly with people, kind of following with them and kind of making recommendations for treatment. If they have other injuries or other issues with other joints, hopefully they will come back in and get this treated as well.
Well, again, it goes back to you made a great point that instead of being reactive, be proactive about it. Mm-hmm. I know Sean's always trying to get me to stuff before the pain comes, and it's very tough, especially for athletes. We're stubborn. We think we can push through everything, and we always wait until we just absolutely can't bear it, which is the wrong approach.
But that leads into what Michael was talking about too. Like everybody's trained to learn medicine right? They don't have anything to do for you until you have a big problem. Right. And if you have a minor problem, you're probably getting a steroid shot or something else. And
actually, that's a great point.
And that's what they don't. They don't want that.
Exactly.
Right? And even our field gets diluted down by everybody's doing a PRP shot now or stem cell.
Right.
Like you go to clinics that have training of zero. They don't have any training, and they're doing this stuff because a joint injection is easy, right? Anybody can do that, but it doesn't mean they know what's going on. Like collectively between us and the other doc in Jupiter, we have almost 30 to 40 years experience doing these kind of procedures.
But also, but talk a little bit about that, because not everyone is the same. Yeah. And I try to express the years of experience and the knowledge you guys have, but I mean, you have a platform now. Like, kind of explain the difference in what you guys do versus the thousands others of places that quote unquote do PRP, because I've had actual, friends and colleagues be like, oh, well, I tried that, it didn't work. And then I almost always think about, well, who was injecting me? Because there's something about, the both of you, when y'all inject, you're very precision, exactly. Sean, you've been doing it blind on me and you can explain what blind means, but and then I know you look like a magician in there. He's got this whole like outfit and thing, and it's like a whole situation. It's like Dr. Evil coming in there and changes. It makes you feel, but it like literally makes you feel comfortable. Like immediately you're like, you even like turn into a little different character. He's a little bit more serious. It's I love it. I love it. It's very
completely agree.
Yeah, no, it's he just gets in this like
Zone,
and then it's funny because then I turn into a different person too, because he's like, I've never heard you cuss that much, and I was like, well, hurt like hell. So I think we both experienced a little different personalities during that
Manning
process.
doesn't like anesthesia for what it's worth, so that's why.
Yeah, I have a weird thing with going under. I don't know why, but I don't like it. But then when I choose to stay awake, it is an experiment to say the least.
Well,
but just talk about your expertise, why y'all are different. What makes you different, especially, and really especially you, Sean, particularly because you literally, like I said, you've been injecting me blind, and explain that to people. What that means.
Yeah, for sure. Somebody said it best. How many restaurants do you go out to eat at, right? Everybody eats, and every chef in these restaurants is different, right? So what makes a Michelin chef versus another chef, right? They all use this. They all have access to very similar ingredients.
Right.
It's how you put it together, right? And so that's the same in medicine. Like when you get into our field, it's definitely a precision art. We all take anatomy, we all learn injection techniques, and it's a matter of how do you put that stuff in your mind together and then apply it to the patient. And I think that's the biggest thing is, in my mind, is attention to detail. Everything you tell me is very important, and we gotta ask the right questions to figure that out. Me, I'm a little unique. I kind of came from a manipulation background pretty heavily. And so that means I do body alignments. I look at body structures and tissue texture. I can almost feel when your tissue is abnormal before an imaging scan will. And sometimes imaging never does, and that shows that our imaging, we have to take with a grain of salt. So we have to use our physical exam, our history. Those are, the guys that taught me 75% of all our diagnoses are based off that. Then we use the lab results and the imaging to fill in the gaps. And something we do at our clinic too is we do dynamic ultrasound, where we can actually move body parts, where if you get an MRI, you're sitting still. You can't look at it when it's moving. And you can see some things that you wouldn't be able to see.
And why is the MRI not advanced? Like, what is happening with our... You can't tell me we don't have technology to do better than that damn thing. Because I just experienced that again, and it's the worst thing ever.
Yeah, MRI, you have to be still. If you're not...
The lady's like, if you move, we have to start over. So you're in there like, don't move, and it, and you're like, I'm not moving.
And it's 40 minutes long.
And it's 40 minutes long. And it's but at freezing ass cold in there. The guy before me walked out, and he literally was shivering, and he was like, I don't know how I just did that. And I was like, yeah, they got like a daggone meat locker in here. And oh my god,
get your cryo in while you're getting
I know, right? Exactly.
You don't need a cold plunge.
You didn't have to do it.
Yeah. Well, going to that point, imaging technology is only as good as the operators, right? Yeah. And what a lot of people don't know is these MRI places have to keep up with their maintenance. And it depends on what kind of programming they put into the machine. There's a lot of variables people don't know about.
Yeah.
And so, it's very operator dependent too. And then it depends on how it's read too. So, obviously, we all are going to use it. We're never going to stop using it. But
right.
Going kind of to your other point, what makes us different? How do we make that different? It comes from a belief that instability is one of the big causes of our injuries. And what is instability? true stability of the joints in the body or ligaments and connective tissue. And when those get injured, it allows motion in a joint, and then your mind will want to compensate by making your muscles tighten up. How many athletes, how many regular people get, muscle activation technique, right? Well, why isn't it activating right? Well, it's because it's protecting your joint that's unstable. And so if we go in and inject to stabilize your joint, then your muscle can activate properly again, and the muscle can actually release itself. Like a lot of people ask me, well, I got a tight hamstring or whatever it might be all the time. Usually it's a little minor injury to it. And if we can regrow that tendon and stabilize it, that muscle can relax. Because so many people are doing PRP now and stem cell and even prolotherapy, that's what grounded me in this whole field, was injecting and that has to do with instability, injecting the joints and the ligament, the tendon structures to stabilize the whole area. But because of all that, I came up with our own unique procedure called the prolograph procedure in order to try to distinguish ourselves. Hey, these are the results we get with PRP or stem cell kind of products, and this is where we can get you. And it's usually, if we're doing a shoulder or a knee, we're doing 10 to 15 injections in one visit, in that area. And a lot of people are only doing a couple.
I was about to say, they're only doing
joint injection.
because I've asked somebody,
1 to 4.
like they're telling me, they're like, hey, I'm going in for a prolo shot or whatever. And I'm like, okay, so how did it go? And they're like, oh, it was easy. And I'm like, all right, what did the guy do? And he's like, he just injected one time. I'm like, well, then you didn't do a prolo injection. I'm like, there's no way that works.
Yep, 100%. And a lot of people are going overseas for stem cells now, and usually they're getting an IV stem cell and one shot in the joint, and it's just not the best way to be doing, I don't want to be classed in that same, in that same arena with those people.
No, I think it's important to distinguish yourselves from, again, it goes back to, in any field, you're going to have a lot of people in your field, and you do have to kind of identify why you're the leader in that field. I'm not a big fan of saying you're the best, because I think there's no arrival of best, right? Like you can be the best today, but then somebody might be outworking you, and then tomorrow they're better. Yeah. So I think, but to be the leader, because your commitment to always, and that's something that I know all of y'all do, continual education.
Well, that's what I want to touch on too. One of my big beliefs is always, like, our field, it changes a lot, and with
monthly, like it's unbelievable. Crazy.
And with the advances in technology, where we can actually know what we're doing now, like with stem cell or PRP, like to a cellular level, much better. Yeah. I definitely believe that, keep going to courses. We go to the prolotherapy courses, the stem cell courses, the ultrasound courses. Before here, how much did you all go to continuing education?
My annual course, maybe 2 at the most.
But nothing like...
No.
What's the last one that y'all recently have done? I know y'all just got back from one of them.
Sean and I just went to a high-level ultrasound course in Denver that was analyzing post-surgical shoulders, getting thoughts and ultrasound from some of the top experts in the country and several top ortho surgeons.
Yeah, it was an advanced shoulder.
Michael, you just got back from one too.
Probably
like the island, right? Like that, wasn't it?
And you had
something you just did
too, didn't you?
Yeah. Probably the one that was most helpful was an advanced spine intervention course that Sean and Ben, one of our other partners up in Jupiter, went to as well. And it was interesting. It's kind of fun talking to people and seeing what they do. And somehow we got on the topic of peptide therapies, which we use pretty regularly, that we can get into as well. And literally there was 20 other docs there, and we were the only ones that really had any idea what those were and how they could help musculoskeletal pain, recovery, help people with rehabilitation, all the other things too. So even folks that were on the cutting edge 20 years ago, they haven't necessarily remained on the cutting edge, but they're still very advanced with what they do, and picked up some really good information that I even used on you when we came back and did procedures. But I think the big key, all of us and the people that are really good at either in this field or any field, are just lifetime learners. They want to just keep adding to what they're doing, or refining what they're doing more and more and make it better as far as outcomes, but also try to see if it can be less uncomfortable or painful for the patient while you're doing it too. But you're not going to be able to remove all of that. So, I mean, I usually tell folks this is going to be, short-term pain for long-term gain.
Right.
It's not without discomfort, but it doesn't last long either. I mean, it's maybe 2 or 3 days for most of the things that we do. Now, are there outliers that sometimes have no pain? Yes. There's some people that get off the table and are like, I'm good. And
The biodisc thing was actually pretty interesting because you told me it would take 30 days. And, I'm hitting y'all up like every 3 days going like, I still feel like shit. You're like, we said 30 days, relax. And literally, I kid you not, like day 35, it was, I'll never forget. It was day 35. I woke up and my legs were back to normal and there was no pain. And I was like, all right. And then of course, start sprinting like a maniac. But
Well, and this
won't
is
go there.
and that's important. Like communication, like making sure that we keep in touch and talk, and just because somebody isn't feeling better doesn't mean they're not getting better.
Right.
And we just got to know what that is and what they're feeling.
Expectations are important too.
Yeah,
Because a lot of people fail. So one of the things I use, well, say you're in 8 out of 10 pain now. And I say, well, realistically, if I can bring you to a 4 out of 10 pain, are you going to be happy with that? Maybe, maybe not. But if I promise you a 0 out of 10 pain, which may be possible, may not be, and you come in with a 4 out of 10 pain, I failed. Because in your mind, I had to get you to a 0. But that's unrealistic expectations. So if you set it at a 3 or a 4 and overachieve to a 0, great. But if they come in with a 3 or 4, then you did your job. Some things are not able to relieve all of the pain and all of the pain receptors and stressors, and there may be multiple parts. Oftentimes, back has to do with hip. Shoulder has to do with spine. A lot of things go hand in hand. And if one thing gets neglected or the patient doesn't want to do both, which happens a lot, then a lot of the times you can't get rid of all the pain, because you're not addressing the whole problem. You're only addressing part of it.
Right.
And that's one of the reasons why we do the diagnostic a lot of the times, because so that to show people, hey, I'm going to block this area. Okay, how much of your pain went away? 50%. All right, well, where's the other 50% coming from? All right, we block another area. All right, half of it. Well, then you still have 25% of your original pain from areas that you didn't even know existed. One of the other things, the questions that you asked earlier, why do not a lot of people do this? And a lot of people, why is this not more common? Because it's not taught traditionally. It's not taught in med school, not taught in residency, and it's very select programs that teach it in fellowship. So
And when you
it's getting
say
better.
taught, you're referring to integrative medicine, right?
It just regenerative medicine, integrative is a whole nother monster.
All right.
Yeah, let's talk more about injections. Yeah, we don't learn these injections in school
Yeah.
at all.
There's no manual to say this is where you should inject, this is the amount you should inject, this is what you use for a hip labrum, this is what you use for a grade 2 tear of the hamstring.
So
There's no manual.
Is this all coming from these
Experience.
clinics that y'all go to? And
Yeah.
that?
Do you mean the courses?
The courses
Yeah,
and
yeah.
Courses
so-
and experience.
Yeah.
Yep, that's it. I mean, that's the problem, is that you can't well, where do I go? There is nowhere to go. That's the hard part. There's a couple places, but a lot of it has to do with technique. How are they trained? What do they use? What do they have access to? What can their patients afford?
Right.
If you have, treatments that only start at 10K, but your patients can only afford 1,000, you're never going to have any patients. So that's the tricky part. When he said blind, the blind technique that's traditionally used landmark based or not using ultrasound or X-ray guidance or whatnot. That's usually what we mean by blind. And sometimes you cannot see the structure. We try to do everything under ultrasound or under X-ray, depending on the body part, but some things just can't be seen or can't be seen well. Sometimes you feel like you need a third hand, trying to hold the tissue with one hand, the needle with the second hand, and an ultrasound probe. You don't have a third hand. Like there's only so many things you can do. So a lot of the times that's how you train. And the hard part is learning ultrasound. I was blessed to be able to do it in fellowship. I was the first class that had to have it mandatory in order to graduate. But before that, it was a free-for-all. There was no one teaching it. There was, you had to learn on your own. It is very time-consuming. Probably 3 to 4 days a week for a year to really be comfortable with it, which is insane. And then you have your post-surgery. You have the post this, or then you don't know what it's supposed to look like. So you don't really have a comparison. It was tough. and it's dynamic. So it's like you move, it moves, and then it's quality dependent of machine. If you have a cheap ultrasound, you're not really going to get good quality. You're not going to see a nerve. You're not going to see this.
There's been a lot of advancement with ultrasound
Oh my God.
lately, though, too.
It's crazy.
Yeah,
Sure.
yeah.
I mean, the other thing that he pointed out, and one of the things that makes us unique is the style of injection we call prolotherapy. Now, the goal for me when I'm doing an injection is to hit where the muscle, tendon, or ligament attaches to the bone, what we call the enthesis. Because traditionally, that's going to be where it tears, and that's also going to be the weakest spot or where the scar tissue is. So my goal is to break up the scar tissue with the needle head, which then the body will reabsorb, and structurally strengthen that area where it attaches to try to create it to be as close to functioning as normal. The problem is when we use the shoulder, there's 23 areas that are enthesis, that can be technical areas. Anterior labrum, superior labrum, each ligament within that. There's 4 rotator cuffs. There's 6 ligaments that hold the AC joint together. You can't hit them with one injection. It's not possible.
Right.
So most people, when they're doing a traditional steroid injection or whatever, they do a single injection in the back. You can do that with your eyes closed, but you're not going to hit everything because there's certain areas that don't reach that injection doesn't get to, because they're not connected. So I almost look at that as, and the injury is like a fire on a mountain. And a traditional approach would be you're standing at the base of the mountain and shooting water up and hoping it hits it. Doing a prolotherapy approach is almost like you're in a helicopter and you're point and shooting where that fire is from the top. Very specific in that. And that fire is the injury. That water is the needle. So you're hitting very specific, very strategic. The worse the injury, the more aggressive you have to be. You can't hit it with mild stuff. It's not going to create, it's not going to be able to address moderate to severe injuries.
Well, since we're sitting in the IV suite, I think we should talk about IVs. And then also I would love to get into a little bit of peptides, Michael, because I think, it's on the forefront. A lot of people are talking about it, but let's start with IVs, because I'm a big believer. I've seen it add value to my life. It's helped me stay healthy and build strong immune system, and then a lot of clarity in my brain. Specifically NAD recently that I've been doing once a week, and I really believe in it. Don't understand why it makes me feel like my head's gonna pop off, but that's a whole nother story. So I guess just and each of you can do it, but start out with why IVs, why, because I think again, it goes back to, instead of being reactive, being proactive.
Right.
And if we can really teach or, help our members and the people listening of hey, you can get ahead of your health by doing these things. So talk a little bit about that.
Yeah. I was not, when I first got into the injections and everything, I didn't think I'd go into IVs, but almost everybody I followed around did them. I was like, why? And they'd have some, especially one doc in Texas I trained with, he'd have people with black feet, and 6 months later, he's back to normal. And I'm like, oh my, what is that? Or somebody that was in the hospital for 4 months and on antibiotics off and on. And finally they signed out against medical advice, and they came and did the IVs with him, and he was better in a week. I saw, and he did that on a regular basis.
Right.
It wasn't one-offs, and it fascinated me that we could actually see that and make people better. But, why did that work? And why didn't, the antibiotics, or why didn't the other IV medicines they did work? And it's because the IVs that we're doing are stimulating your body to heal itself. Whether it be from just vitamins, maybe your gut's not absorbing things very well. And you don't always know it, unless you're a severe case. Like, we've had people come in, they have a bite of food, they're in severe pain all around their body. We tend to see the extremes. Most people of course, are not in that, but if you do IV vitamins, you're going to absorb 100% of what that vitamin is. Like, let's just take 1 gram of vitamin C. If you do it orally, how much actually makes it into your bloodstream? Unless we take your blood and look at the level, we have no idea. But if we do the IV, we know how much is going in directly into your bloodstream.
In there, some stats on that,
15.
It's 15 to 20% of the pill.
Yeah, because your body has to break it. It breaks down in the stomach, and then it goes to the liver, and it gets broken down there. almost everything. Liposomes are a little different, so they can go into the bloodstream directly. So yeah.
The same thing with just a little bit off topic, but the amount of protein you're taking in isn't necessarily the amount of protein you're taking in.
Yep. Good point.
So,
Because of how your body breaks it down.
Correct.
Yeah.
So, I mean, eggs, if you got 6 grams, you're probably getting about 3 to incorporate. So,
yeah,
No, that's a
good point. That way people can think about it on a daily, what
Well, I
you
just
can do
want
on
people
your
to
daily basis.
understand, because that's often the response that I get sometimes. Like, oh, I take my daily multivitamin. And I'm like, yeah, but that's not really what we're talking about. So,
Well, then you also need to know what multivitamin are you taking, and
what brand?
that gets so complex because a lot of people just poop it out.
Yeah.
And then some people they see them on a daily basis, but that's why IVs are just going to be much stronger. And we get a lot of people in our clinic that they're like, I don't want to take supplements. Like when I trained in Integrative, we had 2 schools of thought. One was take 50 supplements a day. The other one was do IVs and take a minimal amount of supplements. And me, I was like, how many people actually follow 50 supplements a day? And I just decided that's impossible. You can't do that for long term. Well, some people do, and I'll give them credit. But I just like the idea. Let's do some IVs, do minimal supplements. We can still get you better. I think one of the, just from basic vitamins alone, I had a guy coming in. He used to come every week religiously. He did it for 6 to 8 months, and then he stopped. He's like, okay, I feel good now. I'm good. I saw him like 3 years later, and he came in and he goes, ever since I did those IVs, my wife and 3 kids get sick. Never gotten sick in the last 3 years. And I was like, see, that's what these IVs can do to you,
Right.
And build your body up. Now we have more powerful IVs like ozone, ultraviolet blood therapy, and that's what this doc in Texas used when people were in the hospital sick as a dog. They came in and did that. That's what got them better. And it stimulates your own body to fight against the infections on a much higher scale than the vitamins alone. You brought up NAD. That's a potent mitochondrial enhancer. If you improve your mitochondria, it's like improving the engine of your car. Everything about it's going to work better. And detox and recovery, healing, all that. There's a lot more complex ones out there too. Methylene blue, phosphatidylcholine, alpha lipoic acid. But the ones that are the mainstays are the vitamins, the ozone. We're going to be starting one called ozone dialysis. EBOO is another technical name. Extracorporeal blood oxygenation ozonization.
That's a long one. EBOO is easier.
But you take blood out of one arm, it goes through dialysis filter, ozone goes into it, then we can pass it through the ultraviolet light or not and put it back in your body.
Yeah.
It's
like getting an oil change.
Basically so, yeah.
But it's just half your blood at once.
Oh, okay.
Yeah.
I mean,
well, we go
an
anywhere from 1 liter to more, but
Wow.
so it's another cool treatment we'll be doing. So the IVs, I've just seen very emphatic results. But again, anything we do with the IVs, you may come in have a pre idea what you want, right? I want vitamins. Okay, you can kind of dictate somewhat, but if you really want to be precise, and that kind of leads us down the testing route, we got to do testing. We got to do blood testing. We need to look for heavy metals in your body, mycotoxins, chemicals in your body, and really find out, what do we need to be treating.
What's the probably the thing that you see the most when you do people's blood work and urine analysis? Like what's the thing that you find to be like the kind of the thing that you tend to always find?
So me, I've gone, I see inflammation, I see some kind of toxicity, whether it be heavy metals or whether it be mycotoxins. And if they're in your body, they're just going to create inflammation all the time, and they can mimic a lot of disease states in our body. The most, pronounced case we ever had was a gentleman in his 70s. He'd been to Mayo Clinic off and on for 1.5 years. And, he was having trouble walking, dizzy spells, his mind wasn't quite right. And they did everything they could scanning wise to figure him out, blood tests, like I said, 1.5 years. And they're like, maybe it's just that time. That's what they told him and his family. And turns out he had mold. And
Wow.
And then, so he was having organ damage. So everybody thought he was just going down. Anyway, we saw that. We ended up also found some heavy metals. So we treated him for both of those things. And he came in on a walker, and then a month later he was using a cane. And About 6 months later, he was riding an ATV.
Nice. That's
So
amazing.
that's how profound, these, if you have, if you know about this field, this is something you should definitely do.
A lot of the vitamins, you traditionally see a place that has a big 1 liter bag. And most of the people don't have any idea what's in it. It's pulled off a shelf. It's got preservatives. You could pretty much give that to anyone. I call that the hangover bag. Like anybody's going to get a little bit better from that.
Right.
But,
Fluids, basically,
correct.
right?
It's predominantly fluff.
Yeah.
And we do it a little bit differently. We don't use any preservatives, which makes them a little bit more expensive, but it's much better for your health. We also, everything's calculated based on, old school Myers cocktail when it's been modified. And it also it's very potent. So you want, instead of being a 1 liter bag, we put it in a 100 ml bag. So 10% of that. And it's very concentrated to get the concentrations in the blood that you want. And it also helps to kind of fix things, as opposed to the way I usually like to describe it is, instead of you getting 1 gallon of gas, which is what we would give you, I almost look at it as, well, you go to another place and they'll put like a half a gallon of water and a half a gallon of gas, or less than that.
So the octane goes to 70.
Yeah. So it's technically still a gallon, but it's a lot diluted. That's kind of what they look at it. And that's why everything that we do in ours is not, there's no shelf. Everything comes out of the fridge. It gets drawn up when you come in, because they have a half-life, because there's no preservatives.
And this is available at Legacy Wynwood.
That's right.
Yeah. But when you get an IV,
suite.
I want you to ask the person how much vitamin C is in that. Is there any taurine in that? Is there any zinc and any selenium? And first of all, they're going to look at you like you're crazy. Then you want you to ask them how much and why. And they're going to be like, I don't know. And then you should say, well, why don't you know? You're giving it to me.
Wait, go back. Say that again, because I think this is very, very important. So as a consumer of IVs, and again, what we're trying to establish here is that not all the IVs are the same, and you need to be very educated on where you're getting your IVs, who's giving your IVs, and what's in the IV. So
Correct.
as a client or a patient, what's the proper questions to ask?
So the first thing I would say, I can already tell you the answer, but I want you to ask it anyway. Do these have preservatives in it? 99% of the time they're going to, because they're really expensive if they don't. Second thing is, what's in this? Does it have vitamin C? Does it have B complex? Does it have selenium? Like, most of them are probably going to have all of these. The problem is their concentrations are going to be really low, like 3%, 5%, 10% of what you really should have, maybe a little bit more. Then the problem a lot of the times is they have a nurse, or they have a PA or NP, someone who's a little bit knowledgeable about it, but not really knowledgeable. We pride ourselves in always having a physician available, either in-house, or if they're here, we're 10 minutes away, we could call or whatever. So, we're treating patients that are sick, that have heavy metal poisoning, that have mold toxicity, that have, Lyme, or high-level athletes. These are very important things that could screw up their life or their health, or they have cancer. We can't just wing it and hope that they feel better, or just peeing out most of it because it's not actually.
No, but it's obviously you're taking pride in what you're using and what you're putting in, but I think it's very important to educate people out there that there is a difference, and that's why I wanted you to repeat yourself. So.
Yeah, and the hardest thing to understand is that concentration aspect, right? Almost the easiest thing to relate it to, because almost everybody has at least a drink here and there, right? Is alcohol. If you have a shot of alcohol versus if you put that same shot in a liquid of 1 liter of water, which one are you going to feel? Right? So if you get the concentrated vitamins, which we put in a 100 cc bag, so 100 milliliters, we put, that 4 to 6 grams of vitamin C. If you put that same vitamin C in a liter bag of water, and then it's going to be a lot different effect in your body. And everything in medicine has to do with concentrations. Our medicines in the hospital, if you're, having a reaction, an anaphylactic reaction, you get epinephrine, right? Well, if you were to dilute that concentration, it wouldn't work. They have to use a high concentration for it to be effective. Same thing with your vitamins. People don't treat vitamins as medicine, but that's what they are technically. And
Well, they were medicine before medicine, right? I mean, that's what we used.
well, right now they're trying to make vitamin C a drug.
Oh, God.
That's the
I don't know if that is that a good thing. I don't know if that's a good thing. That's not a good thing. Yeah.
Then it's going to be controlled.
Yeah, that's
More
not-
regulations.
Yeah, we hope that doesn't really happen.
I mean, that's the thing you see too, and in some of the press, both MD and scientific press and that sort of thing, both in relation to what we do from a regenerative standpoint and also from a vitamin or IV standpoint. You see all the people saying, oh, IVs, there's no role for them. If you are eating a balanced diet, you're good, which is kind of ridiculous. And the other thing is, well, there's no literature on regenerative medicine, which if they would look.
I was about to say there's plenty of
Plenty.
literature. Yes.
And there's actually better literature than certain procedures that are done all the time, like shoulder decompression, which basically is shown to be helpful for nothing other than bank accounts for the most part. There's no data to suggest that's good. I mean, there's studies looking at knee replacement outcomes. 5 years out, 50% of people would not do them again. So, I mean, there's multiple things. Am I saying it works for everybody? No. But if it were me and I had any issue, which I do, I would definitely do that before I would have it replaced. Now, are there people that do well with surgery? Absolutely. And we're not anti-surgery either. I don't want everybody to think, oh my God, if I go there, they're going to give me falsehood. I think Dr. Morse explained it perfectly. I mean, there are certain conditions we can't fix. They've got to be fixed. Or, you know, I had a client the other day that had significant compression in his neck and on his spinal cord. I mean, that to some degree could be a surgical emergency, but again, being proactive, if that can be taken care of early, then his outcome, meaning 10, 15, 20 years down the road, is going to be much better. So that's why we look at everybody and we give them options. Right. Saying, hey, if you had surgery, we can still help you afterwards too. So it doesn't necessarily mean that casts the die, but to some degree, you're removing parts or you're adding parts that aren't supposed to be there. Much better with helping that happen. So you're going to hear people say, oh, that stuff's bunk. There's nothing in the literature about it. If you go to Google Scholar or you go to PubMed or you put in regenerative medicine procedures for the elbow, you can get some good stuff. Chris Centeno is one of the pioneers in this for a company called Regenerative. He's got lists of studies and all that sort of thing that he's put together and put it up against some orthopedic surgery studies. And it's really quite pronounced and profound how much there actually is out there. Now, do we need more? Absolutely. No question.
Is that something y'all are considering getting involved in as far as like, because I mean, as I hear you say it, that's the first thing that kind of stands out to me is it'd be awesome to maybe start some trials in clinic.
It takes a lot of extra work.
Yeah.
And we are, you know, there's things we're going to be implementing in the practice to get data that could be published. You know?
Yeah.
Right now we just have a lot of case studies like you know, and which are great, but you know, how do we quantify that? So
maybe we should all like possibly look into attaching your clinic with like the University of Miami,
100%,
University of Florida, FIU, like these places, and have them like kind of support you.
That would help out a lot because they would have the funding and they would have the personnel who understands how to make it get published.
Right, exactly.
Yeah, and that's what Centeno did a good job of. Is you know.
And again, I mean, even with the studies, there's plenty of people that don't like regenerative medicine. They're putting out studies claiming that it's PRP or platelet-rich plasma, and it is not. Yeah. And they're saying, oh, it didn't work, but they didn't have a concentration high enough to even meet the standard, even though the standard's not perfect.
Right.
But they're putting out sham studies or studies that basically with their goal of trying to make it look like it doesn't work because they either have something else they want to do or they want to do a surgery or
they lose money, right? Like
correct.
Surgeons lose money if y'all are injecting and fixing it.
And that's all over the place. It's not just in regenerative medicine. So you've got to be pretty discerning with looking at what's actually in there and kind of say, okay, this is a good study, that this is something useful. Okay, it didn't work. And, you know, there are certain joints that are better served by regenerative medicine than others. Knees and shoulders do great. Hips, depending on where they are, can do great, but if they're more advanced, they're a little bit more challenged. Wrists, if they're a little bit more advanced. But, you know, that's usually pretty well stated, but be careful just looking at that to say, if you just look at the headline and maybe look at the abstract, oh, it didn't work in in these shoulder patients. Well, what was the concentration? Where did they inject? Did they stick it in the joint? Did they do other structures? Did they use imaging guidance? Did they do it blind? I mean, there's all kinds of discerning things you've got to look at. And it's very important. The same thing as we talked about with the IVs. What's the concentration? How's it going to work? And that sort of thing.
I want to follow up on one thing about the PRP and some of the other stuff. So I like to describe a PRP kit, which most people have heard of by now. It's taking blood out of your arm, getting the plasma from it, kind of getting rid of the red blood cells and utilizing those plasma, spinning it and getting it to a concentration, platelet-rich plasma, PRP. But most places will do PRP now, and it's not super crazy. But the problem is there's different kits for PRP. And the kits correlate to potency, correlate to growth factors within that are extracted, and also correlate to price. There's a correlation to price. So anywhere from $200 to $300 is a super cheap kit, and you have some that are $1,000, $1,500 after the kit is injected. What I want you to understand is that most of the kits that are for aesthetics, face, hair, are going to be weaker. They're designed to be weaker. Those are not meant for shoulders, knees, hips, whatever. You can use them, but they're not really that strong. They're not meant to be strong. When you look at it from a science perspective, the number that he was talking about is the platelet count. And if you go to a doctor and says, hey, I'm going to do a PRP, I want you to ask him or her what the platelet count of your PRP is. And if they have an answer for you, which I'll be impressed, it should be above 1,000. If it's not above 1,000, it's not worth your time. If it is above 1,000, then I want you to look at the growth factor count. There's only 3 companies that I could find out of all of the PRP company kits, all of the PRP kits that are available in America. There's only 3 companies that actually have a concentration above 1,000. That's it. Everything else should not be considered PRP. It's PPP, platelet poor plasma. That's literally what they call it. But
it's a different color too, right? Yeah. Because Sean showed that to me.
Well, that's just if we add some red blood cells to it. So I actually like to add it because it creates a little strong inflammatory response. Yeah. But it's a little different though. We can make it without that too. So.
But in general, that's the problem, is that most of these studies, as you're alluding to, are the poor plasma. They're not strong plasma. Right. So like, oh, it didn't work. Well, look at the kit that they used on. What was the criteria? Did they do physical therapy? Was that, there's a lot of questions. It's not just, and then you also have to look at who paid for it. Who paid for that study? Is it biased from the start?
Of course. Right?
And that's part of the problem, is that a lot of the times there is no threshold. And if there's no threshold for what PRP is, you're never going to get it covered by insurance. And that's why most people won't want to do it, because it's not covered. Just because it's not covered doesn't mean it doesn't work. Right. It just means big pharma doesn't want to pay for it. Yes. Big insurance doesn't want to pay for it. That's the difference. Yeah. But
there's over 50 ways to make PRP, and then there, all the different stem cell stuff out there. There's so many different ways there too. So it's trusting your product, and that's the key about going to somebody experienced in the regenerative field, is you trust that they're going to have done the research in order to give you the best product. And then we have to do the right technique to get you better.
Right. It's the combination of you guys outsource the correct products first and foremost. Yep. And then you know what to do with them, and you're experienced enough to put them in the right places.
And that's why I came up with the term prolograph procedure, because I'm trying to encompass the technique with the product.
Right.
And with us and with Ben, our other doc Ben, we have 4 docs that go to conferences on regenerative stuff, and we keep up with it. And we make sure that we're using the best stuff, at least from our research, that we think that's out there.
I know a lot of people that listen to this are people, my age that want to be young and want to stay young. And like, what's your advice or protocol in terms of just getting started with regenerative and integrative medicine? Like, because this is very foreign to a lot of people. And often people are seeing me getting IVs in here and they're like, what the heck is he doing? Is he sick? Anytime I post it on Instagram, people always send me DMs like, hope you feel better soon. I'm like, I feel fine. So I think there's a connotation or stigma around IVs being, if you're hungover, that's a big one in Miami, or if you're sick, that's when you need it. And I have been doing them for longevity and to get ahead of it.
Correct.
Before I get sick, like let's protect myself before. So I guess what I'm trying to say is why do
we age, right?
Yeah, exactly.
So mitochondrial dysfunction, telomere shortening, and why do those things happen? It's usually toxicities, immune system dysfunction, and gut dysfunction. So if we can improve your gut, get your adrenal glands working, get your immune system back, and improve your mitochondria and detox you, you're going to have age reversal to some degree. Is it going to be how you look, how you feel? Usually it's a combination, and some people, look way different after we finish these IVs. We had, I think this is one of the best stories. We had a guy who wanted to compete in cycling, and so he was in our office 2 to 3 times a week for like 6 months. And he's older. He was about 50 years old or so. And after 6 months, his wife came in and goes, "Okay, it's not okay if my husband looks younger than me," And so she's like, "You got to do whatever you did to him to me."
That's awesome.
And all we did were IVs. We didn't do any facial anything. We do PRP and stem cell for the face and the hair. We didn't do that. All we did was IVs. And
was it just mainly like regular IVs, like Myers cocktail?
So Myers, the ozone, and chelation.
Okay.
Those are the 3 things we did.
Yeah.
And I didn't even have, the audience won't really know, but we didn't have the 10 pass at this time. Oh, wow. So now we have a higher end ozone machine. But, it was just the consistency. And I have a beauty package that I will be coming out with for like an intense 3-month or 6-month version of it.
Nice.
But that's how powerful these things can be. It's just, why though? What did we do? Well, we detoxed the body, got the immune system working better, and got the gut working better. Those 3 things work better, you're going to anti-age.
Biggest piece is just get started and get some data and figure out, okay, what's my baseline and where do I want to be? Right? Do I want longevity? Do I want to perform at a higher level? Do I want to work 5 more years and make X amount of dollars to help myself or my family moving forward? No, I want to retire sooner. Okay, how can I do that and keep my health? I mean, it doesn't matter what your goals are. We can kind of tailor that plan to it. I think the big key is you need to know where you are. So guessing or saying, hey, I'm good, or I eat great. Everybody eats great. Nobody comes in, hi, I was an occasional person. But most people, I got a healthy diet.
Right,
okay.
exactly. They think
Maybe
they
you
have a
do.
healthy diet.
But there's ways to look at that. Even getting like a continuous glucose monitor can be very helpful. Give you an idea. Okay, this food's spiking my blood sugar. You may think it's the greatest thing since sliced bread. Grapes are notorious for that. Grapes for certain people can be great. They got fiber. They've got other phyto and micronutrients in them. But for some people, they spike blood sugar higher than like a Snickers bar.
Wow.
So oatmeal can do that for certain people. So even stuff you think is good for me may not be good for you, but it could be good for Dr. Morse or Dr. Goddard or somebody else.
And that's just the what's supposed to be in the fruits and vegetables, right?
Correct.
Then we get into GMOs, we get into toxins and everything else.
Right.
And how can you eat healthy? Unless you grow your own food, test your own soil, test your vegetable.
Make your own water.
Make your own water, yep.
That's the whole reason I developed my own water. Was the main reason I did it was because of the crap that we find in water. So we were very, very intentional in doing a process that just pulls all the bad out, and then we formulated a proprietary blend of our own essential minerals to put back into it. But I purposely headed into that segue. But let's talk a little bit about hydration too, because it's obviously on the forefront of what I'm trying to accomplish. And I think that we've seen kind of it kind of started with like, the 10,000 step thing. Like everybody, you have to have 10,000 steps, and then the sleep thing became very, very popular with everybody wearing their Whoops and their 8 sleep and all this sleep data. But now you're starting to see like the Garmin and the Whoop talking about hydration and how much water you need and things like that. So where do you see that in terms of health and wellness and where that's heading?
Yeah, I mean, dehydration is the number one cause of fatigue. So, that alone, and that's why we think other IV clinics too, when they get IV, you just get fluids, you're going to feel better. Right? It doesn't matter how diluted it is. And That was one thing I meant to say earlier too. You know, a lot of people just don't understand when they're concentrated vitamins, you can have regular effects from the vitamins, and a lot of people aren't familiar with what those are. So that you get a little worried about side effects. But, you know, going back to hydration, you know, it's very important. And a lot of people think water alone is what you need, but it's not. Like you said, you put essential minerals in, and that's very important, because dehydration is not just loss of water, it's loss of minerals and other elements in your body too.
Yeah, I mean, we're basically big salt bags.
Yeah.
So if you just fill it with water, you're going to dilute that, similar to what we were talking about with the IVs. I mean, the folks that get in trouble in marathons and triathlons aren't because typically they're dehydrated, although it can be a little bit of, is because their sodium is low, not high. So again, usually I'll tell a lot of my clients either use minerals or a pinch of salt in their water or something along those lines too.
Well, the salt tablets, right? They give them while they're running.
Yeah. We could sit here and talk for another 3 hours, I'm sure. But I appreciate y'all's time, and just tell just one more time, like, where your main office is here in Miami, and then I mean, you might as well tell all your offices where they are, and then obviously where we are right now in the IV suites.
Yep. So all three of us practice out of the Miami office, which is at 3915 Biscayne Boulevard. And, you know, we do in-person appointments as well as Zooms or phone calls. And then we also have Jupiter, Florida, Knoxville, Tennessee, and then, of course, where we are right now, IV Suite and Legacy Fit in Wynwood. You know, we work as a team, and, you know, I don't think enough practices do that anymore. So, you know, we talk about cases together all the time, you know, and everything's highly focused on regenerative and integrative IV therapies and lifestyle modifications. So if you want a team and experienced docs who've done over 100,000 injections for musculoskeletal with regen products, that's us. IVs, you know, we have a great team, over 40 years of experience doing IV therapies naturally. So I feel like we've got a good team together, and, you know, we just want to keep learning, keep helping people.
Awesome. Well, thanks, guys.
Thank you. Yeah.